What is the standard anatomical position? Standing upright, facing forward, arms at sides, palms forward, feet together. Which plane divides the body into left and right portions? Sagittal plane. Which plane splits the body into anterior and posterior parts? Frontal or coronal plane. Which plane separates superior and inferior parts? Transverse plane. Medial versus lateral means toward midline versus away from midline. Proximal versus distal describes what? Closer to the origin versus farther from origin. Ipsilateral versus contralateral means same side versus opposite side. Pronation versus supination of forearm. Palm down versus palm up. Eversion versus inversion of foot. Sole outward versus sole inward. 4 basic tissue types. Epithelial, connective, muscle, nervous. Main fibers in connective tissue. Collagen, elastic, reticular. Tight versus gap junctions. Seal between cells versus allow ion passage. 3 muscle tissue types. Skeletal, cardiac, smooth. Where is keratinized stratified squamous epithelium? Epidermis of skin. Layers of the epidermis deep to superficial. Basale, spinosum, granulosum, lucidum, corneum. Simple squamous epithelium location and function. Alveoli and capillaries, permits rapid diffusion. Thick skin lacks what? Hair follicles and sebaceous glands. Which germ layer forms gut and respiratory lining? Endoderm. Number of adult human bones. (206). Two major skeleton divisions. Axial and appendicular. Largest long bone. Femur. Smallest bone. Stapes. Number of cervical vertebrae. Seven. Thoracic and lumbar counts. (12 thoracic, 5 lumbar). Pairs of ribs. (12). Patella is what type of bone? Sesamoid bone. Foramen magnum is in which bone? Occipital. Which suture joins the parietal bones? Sagittal. Cavity on scapula for humeral head. Glenoid cavity. Socket receiving the femoral head. Acetabulum. Which tarsal bone forms the heel? Calcaneus. What is an osteon? Concentric lamellae around a canal. Parts of intervertebral disc. Annulus fibrosus and nucleus pulposus. Shoulder joint type. Ball and socket joint. Tissue lining articular surfaces. Hyaline cartilage. Type of TMJ joint. Modified hinge synovial. Atlantoaxial joint movement. Rotation, no motion. Ligament preventing anterior tibial translation. ACL. Proximal carpal bones, lateral to medial. Scaphoid, lunate, triquetrum, pisiform. Most commonly fractured carpal bone. Scaphoid. 3 cartilage types. Examples: hyaline, as in trachea, elastic, as in epiglottis, fibrocartilage, as in IV disc. Contractile unit of striated muscle. Sarcomere. Filaments that slide during contraction. Actin and myosin. Neurotransmitter for skeletal muscle contraction. Acetylcholine. Motor unit is what? Single motor neuron and all the muscle fibers it innervates. Type 1 muscle fiber traits. Fatigue-resistant, oxidative, suited for endurance. Agonist versus antagonist. Prime mover opposes the movement. Site of adult hematopoiesis. Red bone marrow. What is the mesentery? Double peritoneal layer suspending intestines. Muscles of quadriceps femoris. Rectus femoris, VL, VM, VI.